Welcome to this episode where we're diving into pediatric genitourinary conditions, focusing on diagnostic strategies, clinical presentations, and nursing management. This discussion is based on a detailed quiz prep guide from Perry's Maternal Child Nursing Care in Canada, aimed at advanced learners preparing for clinical practice or exams. So Chloe, where do you want to start?
Let's kick off with diagnostic procedures. Ultrasound really stands out as the go-to initial imaging for assessing renal structure in kids, right? It's non-invasive and, importantly, free of radiation.
Yeah, that's a big deal in pediatrics, minimizing radiation exposure whenever possible. CT scans or intravenous pyelograms, while useful, involve radiation and are usually reserved for more complex cases.
Exactly, and when it comes to urinalysis, the presence of nitrites is a key indicator of urinary tract infection. That's because many uropathogens, especially E. coli, convert urinary nitrates into nitrites.
Right, so nitrites are a reliable biochemical marker distinguishing bacterial infections from other causes of urinary symptoms. It's a neat little diagnostic clue.
Speaking of diagnostics, measuring glomerular filtration rate is crucial for assessing renal function. The DTPA scan is preferred here because it provides functional information, unlike the DMSA scan, which mainly shows cortical scarring.
That's an important distinction. And for urine collection in infants, suprapubic aspiration remains the gold standard despite being invasive. It avoids contamination issues common with urine bags or random samples.
Yeah, accuracy trumps convenience in that case. And after a renal biopsy, the nursing priority is monitoring for bleeding. It's a high-risk procedure for hemorrhage, so vigilance is key.
Absolutely. Encouraging fluids or assessing bowel sounds come later, but bleeding takes precedence immediately post-procedure.
Moving on to urinary tract infections, E. coli is the predominant pathogen in pediatric cases. It's responsible for the majority of infections.
And the risk factors are interesting. Constipation, vesicoreteral reflux, and incomplete bladder emptying all increase UTI risk. Constipation can mechanically impede bladder emptying, promoting bacterial growth.
Vesicoreteral reflux allows urine to flow backward, giving bacteria a direct route to the kidneys. And incomplete emptying leads to urinary stasis, which is a perfect breeding ground for bacteria.
Girls are at higher risk mainly because of their shorter urethra, which reduces the distance bacteria have to travel to reach the bladder.
That anatomical factor is often overlooked but critical. Clinically, fever is a hallmark of pyelonephritis, distinguishing it from lower UTIs that might just present with dysuria or frequency.
And in terms of prevention, teaching families to maintain adequate hydration is more effective than focusing solely on voiding frequency or wiping technique.
Right, hydration helps flush out bacteria regularly. Now, about preoperative preparation for children with structural genitourinary defects, age-appropriate teaching is essential to reduce anxiety.
Definitely. Using developmentally suitable explanations and tools like dolls for toddlers helps children understand what to expect without overwhelming them.
Emotional support for both the child and parents is a key nursing role here. It builds trust and reduces preoperative stress.
And it's important not to overload families with information all at once. Pacing the information reduces anxiety and helps with comprehension.
Shifting gears to nephrotic syndrome, the hallmark is massive proteinuria, which leads to hypoalbuminemia.
That loss of albumin reduces plasma oncotic pressure, causing fluid to shift into interstitial spaces, resulting in edema. I like to think of it as a leaky bucket, where protein leaks out and fluid follows.
That's a great analogy. Nursing priorities include strict input and output monitoring to detect fluid imbalances, and fluid restriction to manage edema.
Infection is the most serious complication here because urinary loss of immunoglobulins and complement factors compromises immunity.
So vigilant infection control and monitoring are essential. Also, lipid levels tend to be elevated due to hepatic compensation, but hypoalbuminemia remains the key lab finding.
Bed rest is less emphasized compared to fluid management and monitoring, which is a subtle but important point.
Comparing nephrotic syndrome with acute glomerulonephritis, AGN is commonly post-streptococcal and presents with hematuria, hypertension, and edema.
Whereas nephrotic syndrome features massive proteinuria without significant hematuria. This distinction guides nursing care, AGN focuses on blood pressure control and fluid overload monitoring, nephrotic syndrome on protein loss, and infection prevention.
Exactly. Now, acute kidney injury in children is most often caused by dehydration, leading to oliguria.
And hyperkalemia is a life-threatening electrolyte disturbance in AKI, so prompt recognition and management are critical.
Chronic kidney disease leads to anemia due to decreased erythropoietin production, which is a major consideration in long-term management.
When it comes to dialysis, peritoneal dialysis is the most common modality in pediatric patients because it's home-based, offering flexibility and less disruption to family life.
Plus, it avoids vascular access complications and hospital dependence, which is a big advantage.
Recognizing transplant rejection is vital. Signs include fever, decreased urine output, hypertension, and graft tenderness.
Low creatinine is not a sign of rejection. In fact, creatinine usually rises due to impaired graft function.
So to wrap up, the key takeaway is how diagnostic precision, understanding pathophysiology, and tailored nursing care all intertwine to optimize outcomes in pediatric genitourinary conditions.
Absolutely. Integrating these insights into clinical reasoning and patient education supports both acute management and long-term care planning.
Thanks for exploring this complex topic with me. It's always rewarding to unpack these nuances.
Likewise. Hopefully, this deep dive helps listeners sharpen their understanding and clinical approach.